I invite Dr. Praveen Vashist, heads the community ophthalmology in AIMS and doing a lot of work for sitting in the apex center to the whole country.
Thank you, Natarajan sir. In fact, it is my privilege that at this stage I am sharing this stage with probably the most well-known ophthalmologist in the country. Thank you, sir, for inviting me. In fact, today I would like to give you some initiative that has been taken by Government of India for elimination of trachoma in India. Trachoma is still, mainly in African countries, is considered the most common cause of infectious blindness. WHO started a global elimination trachoma program in 2000, and now that they will eliminate trachoma by the year 2020. But unfortunately, among CRO country, India is the only country where WHO has not yet declared trachoma elimination. We have a huge history. In fact, in 1959, it was first time ICMR survey was conducted, and where we came to know that the burden of trachoma is very high in northwest part of the country. In fact, this is the status. In Punjab, Haryana, you can see the prevalence of active disease in 1950s was more than 50%. And at that time, the name of the national program in 1960, it is National Trachoma Control Program. It was not NPCB, it was National Trachoma Control Program. In fact, in 2006-07 also, the burden was reduced significantly. But this is one success story of Andaman Nicobar. I became head of department and I was invited by Government of India to see the burden. And surprisingly, when we visited there in Nicobar Island, we found that 51% children, they had active disease, 51%. And it was one of the important cause of blindness there. It was probably the first time mass treatment was given with azithromycin for consecutive 3 years in the entire island of Nicobar. And fortunately, we got the huge reduction of trachoma in that area. In 2013 and 16, when we conducted survey, the prevalence of active disease was nearly 1%. From 51%, we reduced it to nearly 1%. And then it was planned whether to assess actual burden of trachoma. We got this National Trachoma Survey from 2014 to 2017. Again, it was funded by NPCB. And it was conducted in 27 different districts in the country. 10 districts where trachoma was hyperendemic, so we did prevalence survey there. And in another 17 districts, we have taken randomly one district from each state by rapid assessment to actually assess whether trachoma is there in rest of the country or not. As per finding of this survey, we were happy that the burden of active disease in children from 1 to 9 years of age, it was reduced to just 0.7% in the country. 0.7%. WHO cutoff for elimination is 5%. So you can understand, we were proving it in 2017. If somebody could have done this kind of survey way back in 2000 or maybe 90s, probably would have declared trachoma in children at least free at that time also. 0.7 is such a low figure. And in fact, at that time, our ministry, health ministry, they declared that at least children, they are free of the burden of trachoma is not a public health problem. But what about trachomatous trachiasis? It is actually, trachiasis is commonly seen in 15 plus age group as a complication of trachoma, active trachoma. What we got is the prevalence of 3.5 per thousand in 15 plus age group, trachomatous trachiasis. And the cutoff criteria for WHO for eliminating trachomatous trachiasis is less than 2 per thousand. So we could not declare that India is totally free of trachoma. But we actually finally called a WHO team, which was led by Dr. Solomon, who is even now the program officer for trachoma in London School and WHO. And we discussed whether we can declare India free of trachoma. But he said, no, you can't declare. In fact, he said you have to conduct survey in all the previously hyper-endemic districts in the country. And when we assessed, that number was nearly 200 districts. They said trachomatous trachiasis survey has to be conducted in all 200 previously endemic districts. And if the prevalence satisfies the WHO criteria, only then India can declare trachoma free. And he also said that we have to show that the safe strategy for trachoma has been implemented in all those parts of the country. So as part of the ministry, decision was taken that we'll do this thing. In fact, all training were given at national level, state level, district level, and PSC level. Modules were developed. The people were trained. IEC material were developed. That means in all those 200 districts, which are spread in 11 states in the country, the Trachoma Safe Initiative were implemented. And in fact, surveillance report, all the districts are supposed to submit surveillance report if any case of active disease or trachomatis tracheasis has been identified. And then, as I mentioned, that 200 districts to be covered with this survey, this work was given to RP Center. I was made principal investigator. And this is the list of those 200. This is the distribution. You can see that this is the northwest part of the country. And these are the 200 districts, state-wise. One important thing which was given by WHO is that if a TT case is known to health system, then it will not be included in prevalence. So somebody who has been operated and recurrence is there, or somebody who is known to health system where tracheasis has been removed, that will not be included in prevalence. So in fact, we assess the prevalence of trachomatis tracheasis. And in fact, WHO Tropical Data Group was our partner for this survey. They did training to trainers in our RP center, and we further train our team members. 3,000 was the sample size in each district. So you can understand we had to cover at least 600,000 people by house-to-house visit in 15+ age group. And of course, from each enumeration unit in the district, they took 30 clusters, and from each clusters, 35 households were covered. We mainly examined for tracheatic lashes, eyelashes, and also for upper lid scarring on those individuals. Of course, quality assurance was an important component. All the data was entered in tropical data software. It was online data entry in mobile phones. And regular checkup. Daily data cleaning was maintained, and we are submitting data daily to tropical data team. I'm happy to share that we have just completed the survey in 200 districts. We have enumerated 730,000 population. I believe this is the largest ever survey globally. Nobody has gone to such population and community. The coverage was 88.4%. 645,000 people were examined. The TT cases who were unknown to health system, total number of cases identified were 162. Again, the prevalence was just 0.25 per thousand. You can understand the cutoff was 2 per thousand. We got 0.25 thousand. And in all the state, the prevalence was less than the WHO criteria. This is summary table. This is all details about enumerated population, each state, examined, TT unknown to health system, and also we look for corneal opacity due to trachoma and blindness due to trachoma. The prevalence of all these things is extremely low. So just 0.25 per thousand is the prevalence against WHO cutoff 2 per thousand. So we can understand that trachoma is definitely eliminated in our country. It is no more a public health problem, but we have a process. Now, the government of India has kept a task force. I'm member secretary of that task force. The meeting is kept on 22nd of this month. In that task force, we'll be finalizing a dossier, which will be submitted to WHO. And based on that dossier, WHO is expected to actually declare that India is free of trachoma. And it is planned that by this year, probably by the end of September or October, hopefully we'll get declaration that India is free of trachoma. Thank you very much. I'm really thankful to Government of India, WHO, tropical data teams, chief RP centers, and all the partners, district, states, who help us in this survey. Thank you very much. Thank you.
Thank you, Praveen, for your passionate work you're doing from All India Institute. Nag, you want to say something? Boris? Yeah.
So actually, I think in Russia at that time it was Soviet Union. The trachoma was eliminated in about 1960s or 70s. So it was kind of again government program, which we can see here as well. So because without government support, it's not possible, because you have to go to the rural areas and treat all these people, and that's But I believe you are at the final stage of that story. So it's congratulations to all your hard work in that area. Yeah.
I just want to congratulate you for completing such a mammoth task and finally getting it all done. Because in 1970-74, when I was a resident in RP Center, every alternate patient used to have some signs of trachoma. And from that stage to this stage was an uphill travel. And then the other thing that in the late 90s and the first decade of 2000s, when I was frequently going to Geneva, they were constantly asking me, Nag, ask your government to get it done and get a trachoma-free country status for India. And I used to tell them, we don't see trachoma. They said, no, that doesn't serve the purpose. There is a system. And I'm glad that it's all done now, and we are a trachoma-free country.
Thank you. Ravi, any comments?
I just have one doubt, Praveen. Every now and then I think we have these tribal, remote, vulnerable populations. Occasionally I get it out, even in our states. Do these people have trachoma? So I don't know if you've looked at some of those.
In fact, one of the important component is surveillance in each and every district and monthly report. And the process was that from PSC level, it will go to CHC, CHC to district level, and district will report to state and to center. And we are submitting annual report to WHO. So that was part of the process, surveillance, along with this survey. So we hope that it is not there.
But as he said, we can also probably contact, apart from this, what we have done excellent, whether we can contact the tribal community all over India.
I would like to mention one thing, sir. You know, the prevalence of active disease is like the WHO taken a big figure. So less than 5% is taken as elimination criteria. So even tribal area, if we find some cases, the prevalence, they will definitely be less than 5%, hopefully, sir.
Sure. No, I know, but just to serve them, because we have so much of tribal, and our Prime Minister also was talking about tribal welfare, and during the GE meeting also he did that. Good. But anyway, wonderful work you are doing, and applause to you. Can I request the speakers to come here? We can have a group photograph. In the meantime, any other question? Any other comments from colleagues from Russia? Okay. If not, thank Dr. Namrata Sharma, the scientific chair, for giving us the opportunity from ICO to discuss this in India. Thanks to Boris for accepting in the last minute. Thanks for